Hi everyone, welcome back. I am Dr. Forest-Lam. I previously put some talks in YouTube, and I was first started to kind of feel out uh, what my audience wanted to hear as far as medicine and what level of complexity my audience want to hear. And I've come to the conclusion that I stick with what I do a lot of, which is to learn internal medicine, teach internal medicine, and help some of you reach a higher score on the uh, ABIM exam. And so here we go. I'm going to change my format a little bit. So I'm going to talk a little faster, use terms that we all used to use on rounds and communicate with our colleagues. I want to get our mindset into this time period that I recall that assume that you have your exam's coming up in a week or two. I want that kind of urgency, and I want to present my material as concisely as possible and to the point, and the best use of your 30 minutes. And as you know, some researchers seem to indicate that if you learn something 30 minutes later, in the nuggets of 15 to 30 minutes, that really help consolidate the best use of your 15 30 minutes. So fasten your seatbelt. So marijuana is not the biggest topic, obviously, but I want to set a non-biased view of marijuana because there's a lot of talk about it, and the board seems to like to put questions that are ripe for for picking. So anyway, marijuana use and misuse. Marijuana contains many mind-altering substances produced by the plant uh, uh, sativa plant. It's called cannabis sativa. Marijuana contains many several hundred components which are have varying degrees of this psychoactive effect. The major one, THC, of course, is stands for 9 tetrahydrocarbonol. Is the primary ingredient which produces the most psychoactive um, substance. As the other one is like CBD, which is the one that produces a lot of good side effect, calming effects that many people claim to have feel that seem to contribute to. Um, Marijuana is a Schedule One substance under the Controlled Substance Act (CSA) with no current approved medical use in the U.S. So, uh, and there's no safe use or research, so it doesn't qualify for any any company or medical school to really do experimental. That's what Schedule One is. Experimental. But, although some states have loosened up this restriction, it's still federally it's not approved for any medical indication. Um, Again, some states have allowed it for medicinal use, but the federal DEA still has marijuana on their target. And so a lot of just like some of the medications that we use as like medications that are for uh, uh, weight reduction and lipid modifying, they use um, for it's off-label use if possible. Marijuana is grown in the U.S., Canada, South America, Asia, Afghanistan, and the Middle East, and in the Caribbean. When marijuana is smoked, the THC uh, substance enters the bloodstream. It enters then is delivered to the organs and the brain. And in the brain, THC uh, interacts with cannabinoid receptors on the neurons and influences the activities of those cells. Um, uh, THC's interaction with these cannabinoid receptors in parts of the brain can exert the following effect on the individual. There's pleasure, memory time, and sensory perception changes. Coordinated movement is affected. Thoughts and coordination also affected. The effect of marijuana can be on perception, coordination, and responsible for growth, impairment in learning, psychomotor behavior, and associative processes. So sometimes it's affected to the point where sometimes they perceive happiness with sadness and sadness with happiness. Sometimes they'll laugh when people are supposed to be sad, and vice versa. Chronic regular use of marijuana leads to physical dependence and withdrawal following cessation of use, as well as a addictive psychoaddictive tendency. Over the years, literatures and behavioral studies have revealed that the effects of marijuana vary amongst individuals. Commonly respond to cannabinoids in a varied fashion, widely variable fashion. Facial flushing, apathy on the board. That's the answer they're looking for. What is the most common side effect of marijuana use? Apathy. Paranoia, which is pretty common also. Tachycardia, jitteriness, dry mouth, dizziness, sensation of high. They feel high, yes. Uh, Fast mood swings, feeling good one minute and feeling bad and sad and regretful for another. Increased sociability, disinhibition, loquaciousness, enhanced sense of perception, and appreciation for art and music. So they're very, very creative. There's increase in appetite, short-term memory is impaired. There's panic attack and impatience. They're pretty impatient people with the high. Uh, Short-term physical effect of marijuana um, highs is highly associated with sedation, um, conjunctival injection, bloodshot eyes, coughing, increased appetite, and often incongruence of mood, like lability. You get scared of sadness and happiness swings. Um, Marijuana smokers show signs of symptoms of bronchitis, emphysema, and bronchitis. Um, and after all, it's a form of cigarettes. The immune system may be suppressed in extended use. Cannabis can be grown outdoors or indoors, and there are many names for marijuana. Um, Frequently used names include dope, grass, hash, joint, Mary Jane, reef, weed, and so on. Marijuana is a dry, shredded, greenish brown, roasted mixture of flowers, stems, leaves, and seeds of of the cannabis sativa plants. The mixture is typically green, brown again, and not unlike tobacco. Um, Usually smoked as a cigarette or roll joint with a cigarette paper, or in a pipe or bong. It also can be smoked with the cigar hollowed out and stuff in there, and sometimes additives like other mind altering substances are also stuffed in there and smoked together. Marijuana is also mixed with other drugs, of course, um, and made into cookies and tea and whatever the imagination take 'em. After it is smoked, the active component from the lungs then travel to the bloodstream in the brain. Um, Withdrawal from chronic use of high doses of marijuana use cause physical signs, including stomach pain, nausea, headache, uh, uh, diaphoresis, tremors, anxiety, uh, irritability, and decreased appetite. SYNDROS it's a proprietary formulation. It's a Schedule 2 oral cannabinoid solution used for treatment of anorexia associated with the weight loss in patients um, that are not responding to the more conventional antiemetics. Then, lastly, Epidola, Epidolax, which is spelled here, Epiidolox. It's Schedule 5 under CGA, CSA, I'm sorry, Controlled Substance Act, contain the cannabinoid used to treat that's CBD. That's the one that seems to make people kind of happy. The main ingredient, besides THC, that's often touted as the main ingredients in marijuana. Uh, it is Schedule 5. Um, not really, not really controlled, so to speak, but because it's it's the least potent form of the Schedule CSA class. It's used to treat two epileptic conditions. These are very high, right for uh, for testing. Really, it's so this there was Epidolax is for Jovet syndrome and Lennox-Gastaut syndrome. I just heard of these entities. I've never diagnosed any of these. But they may ask you of the marijuana components, uh, which which one is used commercially for control of seizures, or which seizure conditions uh, is uh, is Epidolax Dolax indicated for. So with that, um, good luck. This is a fast. You like it? Here it is.